Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Dyspnea. Dyspnea. Dyspnea is defined as undue awareness of respiratory effort. So when we were breathing, we cannot hear our respiration. We cannot feel that we are breathing. Though breathing is an involuntary activity, but we do not feel the breath of a person. So, but if we are aware that the patient is breathing forcefully, then it is dyspnea. Or if the patient has to increase his effort in order to breathe properly, then that is also called as dyspnea. So dyspnea can occur in two main conditions, actually three. So dyspnea can occur whenever there is increased work of breathing, or if there is increased demand of breathing, or if there is increased respiratory effort. Increased work of breathing. So in increased work of breathing, in thickened pleura, if there is thickened pleura, the lungs have thick pleura. So the lung muscles of the lung have to strive hard in order to push the thickened pleura in order to expand. So this increases the work of breathing in the lungs. Similarly, if there is pleural effusion, in pleural effusion, the pleural cavity is filled with the pleural fluid. So the pleural cavity is filled with the fluid, and this will increase the work of the breathing. If there is pneumothorax, then the pleural cavity is again filled with the with the air. So now the lungs have to expand, pushing the air out. So as a result, this increases the work of breathing. In airway resistance we have upper and lower airways, like the bronchiole, we have the whole respiratory tract. So in airway resistance, if there is any resistance in this respiratory tract in the airway, then obviously there will be increased airway resistance. This increased airway resistance will increase the work of breathing. So whenever there is increased work of breathing, this is responsible for dyspnea. Second, increased demand of breathing. Increased demand of breathing is seen in certain conditions like hypoxia, anemia, acidosis, and thyrotoxicosis. In these conditions, there is increased demand of breathing. In hypoxia, already the body is having less oxygen, so the body is in demand of more oxygen. So the patient has to breathe more. So in hypoxia, there will be dyspnea. In anemia, there is decreased hemoglobin is present. Hemoglobin is the medium for transport of oxygen. So decreased hemoglobin, decreased oxygen, thus there is increased demand of breathing. Then in acidosis, third, in acidosis there is increased H plus ions are seen. So if there is increased H plus ions, these will stimulate the respiratory center, thus increases the demand of breathing. In thyrotoxicosis, there is increased demand of breathing, because in thyrotoxicosis there is increased metabolic rate of the body. So increased metabolic rate increases the oxygen requirement of the body, thus increasing the demand of breathing, leading to dyspnea. Then increased respiratory effort. Increased respiratory effort is needed in conditions of breath holding. If the person is holding his breath, then that increases the respiratory effort, and increased respiratory effort is also important in paralysis of respiratory muscles. If the patient has paralysis of respiratory muscles, then obviously he should increase the respiratory effort, thus resulting in dyspnea or breathlessness.
thank you and thank you for watching.